All right, we are now live. Thank you all for tuning in. Joining us today is Dr. Sriram Vijayapuri, consultant cardiothoracic and lung transplant surgeon at Therrapie Multispeciality Clinic, Bangalore. He's internationally trained at the Temple University, USA, UPMC, Peter MacCallum, Melbourne, and NHS Leeds. Dr. Sriram is one of India's leading voices on thoracic surgery and healthy aging. His message is simple: pain is common, dependency is optional. Please welcome Dr. Sriram. Thank you so much, Dr. Sriram. Over to you.
Thank you, Nikhil. That was a good introduction. I'm really grateful to the Therrapie Multi-Speciality Clinic, Dr. Neema Bhatt and and Vikas Mathur, and also to our team led by Mr. Nikhil. Today we will be talking on a very important topic, which is active living after 65 years. So I am Dr. Sriram Vijayapuri. I'll be presenting this topic to you. So my first slide is it's about, in this slide we see a person. As soon as we see this slide, what do we conclude from it, or what are the things which come to our mind? I'll give 10 seconds just for you to see the entire slide. So, what do you think? See someone from behind. The common things are that they are going somewhere. That's what we can make out from the slide, that a person is going somewhere. The focus, actually, what I want to convey to you is the focus is on the path ahead, and it is not on the past. So that is a very important line here. The focus is on the path ahead and not the past. And the story is not about the story is about what is coming. It is not what is gone. So two important things: look forward. The focus is on path ahead and not the past. The story is about what is coming and not what is gone. So with this, I would like to talk about that, how we should see active living after 65. That is, we should be, I feel that moving forward, in this picture I can see a actively aged person who is moving forward calmly, confidently, and after a good thought, I have removed the identity. I have not put any labels on him. That one thing is to protect the dignity. I have removed all labels so that it allows every one of you to see yourself in that figure. That's what I wanted to convey to you. You should see yourself in the figure. And it's just like they are simply walking. The calm normalcy is powerful at 65. That's what I wanted to convey to you. Moving forward calmly and confidently. So we should be focusing on the path in front of us and not about the past. And this is a new beginning, and it should be like going forward. So the calm normalcy is powerful at 65. So this brings us to today's topic, that is living active and independent after 65, thriving, how to stay healthy, strong and happy. So I would like to convey one message here, that is, if you are happy and if you are strong, you will be healthy. That is how it should be. So I changed the slide like one male, one female, so that there should not be any gender bias. This is for whatever I am talking today is for active aging after 65. That is, you still have control over your body, your choices and your joy. most of you who are following this webinar will already be doing most of these things. I just want to also add few things which I won't say you would have missed out, but if it crosses your mind again, then it will reinforce the way you are. You can add it to your life and you can become more active. So you are already doing many things right. Let us just build on that. That's what my main this one was. What is active aging? Active aging means you are staying physically mobile. So the most important thing is you are mobile physically, mentally you are sharp, socially connected, and emotionally positive as we grow older. And all these things despite your medical conditions. Active aging means, again, you should be staying physically mobile, mentally sharp, socially connected, and emotionally positive as we grow older, despite the medical conditions. So, any person who has some sort of illness can still be actively aging by physically being active and trying to mentally be sharp, socially connected, and emotionally positive as you grow older. So, in active aging, I have constructed 4 pillars of active aging. That is, one is physical health, one is mental engagement, and other one is purpose and meaning and social connection. So, let's take one by one. The first important thing I want to tell everyone is move every day. Move every day. That is the most important thing. No movement is equal to faster aging. So kindly move every day. Minimum what you should do. Minimum is you should walk at least 30 minutes in a day. If you can, you should walk 30 minutes in the morning and 45 minutes in the evening. If for due to some illness or some mobility problem you can't move, at least we can do 10 minutes of walking, 3 sets or even 1 set. So that would be ideal. If a person has some mobility problems like knee pain or back pain or anything like that, even chair exercises are helpful. And light weights or resistance bands 2 to 3 times a week is very helpful for maintaining your health agile. Benefits of moving: it helps in better breathing, it causes less joint pain. If the joints move, if you move, the joints are flexible, it causes less pain. Otherwise the joints become stiff and immobile, and you get most important thing, why should we move around? Because most of the plus 65-year-old people or most of the age population, their main complaint would be, I can't sleep at night. So if you move around, you may get a better sleep. That is why you should be moving around. And once, like a baby, how it learns walking, if you keep on walking, the fewer the falls it happens in your life. So that is also very important. That's why you should keep walking. So fewer falls. Remember this: better breathing, less joint pain, better sleep, fewer falls. All most of the problems are solved here. Better breathing, that will improve your heart and lung, that will keep your lung and heart healthy. Less joint pain, most of the joint pains are removed from because of walking. Better sleep, neurologically you are more sound the next morning. And fewer falls, so less trauma to any trauma or injury to any part of the body. So this is why we should move around every day. No movement is active aging. Benefits: as I have already told you, if you move, that helps in breathing, that is, it expands the lungs better. It expands when you move, the lungs expand better. When we walk, stretch, or exercise, we take in a deep breath. When you take in a deep breath, what happens? It opens up the small air sacs, what we call as alveoli, and this prevents the collapse of lung areas, and it improves the oxygen exchange. And when you move your body, your lungs open up like balloon. So this is very important. So when you move, it improves your breathing. Movement, as I've already told you, it reduces the joint pains. So it lubricate as you move, it lubricates the joints, it strengthens the muscle around the joints, reduces stiffness, improves blood flow, and helps when you move, it automatically you are more fit. There could be some amount of weight loss or weight control, what we see. And another important thing is there is release of natural painkillers, what we call as endorphins, and that will help you to be more happy, and that will make you strong, and that will make you healthy. If you don't move, what happens is your joints become stiff, and if you move gently every day at least, then your joint becomes free. So whatever I am telling you, even if you follow every day simple things, then we can make a great change in our day to day life. So the first thing is you should move. Next, as I have already told you, the most important of all, that is, movement helps better sleep. It regulates the body clock, what we call as circadian rhythm. It reduces stress and anxiety. It makes the body naturally tired. That is a healthy fatigue. If you move, your body becomes more tired, and that gives you sleep at night. So try to move during the day, and that your body is naturally tired by evening or night, and you can sleep well. And once you are tired and you go into sleep, it improves the quality of sleep. You go into a deep sleep, that improves the quality of sleep, and when you get up, you feel more relaxed. So it that is very important. And again, it reduce by movement. If you get a good sleep, it reduces pain and discomfort. It also helps in control of your weight and breathing problems. So if you the most important thing, carry home message is, if you move more in the day, you sleep better at night. That's the take home message. As I have already told you, by movement, it helps prevent falls. That is, it improves the muscle strength, it enhances the and balances and coordination of movement will be there. It increases your bone strength, it improves reflexes and reaction time, it maintains joint flexibility, and more than anything, it builds confidence in the movement. So that is more important. As you move, it builds confidence for you. Ultimately, you are happy, you are strong, you are healthy. That is my core message. The more you move, the steadier you become and less you fall. So as you age, some people have this habit of falling quite often. How can you prevent that? By moving. The more you move, the steadier you become, and less you fall, and that is very important. So again comes to the next one, that is, one of the most important thing is the food habits. You should eat for the strength, not just for taste. So the common problems in the old age is low protein intake. So what we can do is simple things, like in every meal you can have protein in every meal. That is either a dal, paneer, or any of these proteins. So you can have that, and always include fruit and vegetables in your daily meal, or any time of the day. Please include fruits and vegetables, and that will also be helpful in your digestive system. And the other thing is, most of the people don't take adequate water. You should take adequate water for normal functioning of the human body. Water is very much essential. And avoid excess salt and sugar. So common things are protein in every meal, fruit and vegetables to be included, adequate water, avoid excess salt and sugar. So eat for strength, not just for taste. You should eat for your strength. Of course, taste matters, but along with taste, you should also worry about your how to get strength. So what are the things? Protein in every meal. It can be dal, it can be egg, it can be milk, nuts. They help to maintain muscle strength and immunity. Fruits and vegetables provide vitamins, minerals, and fibers. They support heart, brain, and digestion. So, and adequate water intake. Aim for at least 6 to 8 glasses per day, unless you are restricted for some conditions or failure of some organs. The physician or the specialist would have told, have this much only, 1 liter, 1.5 liters, like that. So including your all diet, including your medicines, everything, follow those things. Otherwise, aim for at least 6 to 8 glasses per day, and prevents dehydration, constipation, and fatigue. Limit salt and sugar. It reduces blood pressure, diabetes, and heart risk. It avoids packaged and processed foods. The simple message is that food is your daily medicine. Eat to stay strong and independent. This is what I want to tell you. Food is your daily medicine. Eat to stay strong and independent. That's it. So, what are the things in the food? Protein, adequate water, fruits, vegetables, and limit salt and sugar. Next, this is very important. As you age, keep the mind busy. Unused brain ages faster. Encourage, please read if possible. Listen to music. Play with your kids or grandkids. I think grandkids. Play with your grandkids and listen to music. Involve in some hobby, even gardening, all these things. That will really help your mind to be busy. And this is a very important message for you. Try to learn something new. Something new. And as you know that every person, most of the person nowadays, they can live alone with only this thing in their hand, that is mobile. They We can stay alone because of mobile, but how do we use it to our best? By learning one app every day. That helps you to keep your mind busy. So don't tell that I don't know many things in mobile, I am not this generation, I am old generation, I can't learn anything. This is for everyone. Do you know, child doesn't know anything, but it learns. How does it learn? I don't think father and mother has the time to teach the child now about any apps. They learn by doing it again and again. They just practice, practice, practice. That's why practice makes man perfect. So with that saying, that's how the kids learn. That is how actively aging population above 65 should also learn. They should not just tell that it is due to generation, technology, I can't know. Keep on doing it, you will learn. So that is one important thing. Solve puzzles. That will make your brain it will keep your mind busy and strong also. The other important thing is teach grandchildren. Teaching grandchildren also helps you, so your mind will be busy. So teaching is also one more thing what you can do. Why am I stressing about mental, keep the mind busy? Because by keep giving your mind activity or mental activity delays dementia and depression. That is the one of the most important problems in old age, dementia and depression. How can you control that? How can you effectively prevent it? By keeping your mind busy. So puzzles and phone apps doesn't require any support. These two are available with you all time. You can use. You can learn everything by your own. And teaching someone, grandchildren or anyone, teaching any children about anything, that is the best way of keeping your mind busy. So keep your mind busy, keep your brain healthy. Mental activity delays dementia and depression. Staying active, I have already spoken much about this. So try to learn and try to read, write, puzzle, crosswords, all these things. Learn music, language, hobby, anything. Okay. Stay socially connected. That is the most important thing. talk to friends, family, join groups, community activities. All these really help you make your mental mind busy, and it will keep your brain healthy. And one more thing is, keep your mind keep your mind calm. That is one more important thing. Keep your mind calm. Meditation, prayer, breathing exercises, all these things keeps your mind calm. Reduces the stress and improves focus. So keep your mind calm. Another thing is, have small goals every day. Something like helping others, volunteering, or have some goal every day. Watering the plants, or walking to this place, coming back. Have simple goals which you can finish and you feel happy about it. That is the purpose of daily have a purpose that will make you feel more healthy, and that will keep you happy. So engage your brain every day. So most important message from this is, a busy mind is a healthy mind. Next, staying social and purposeful. Loneliness is very important thing, is as harmful as smoking. So loneliness is very harmful. So try to try to get involved in groups, make friends, going out, get socially connected, and be and purposeful. That's why, please go for walks, walk in a group, join a morning walking group, go to the nearby parks. There are laughter clubs, there are clubs where they just sit and chat about what's happening, politics, sports, everything. You can join that group, because loneliness is harmful as smoking. You can go to community visits, you can go to temple visits, or the best thing, the most powerful person in this world, I feel, is a volunteer. So become a volunteer. There are so many organizations, or there are so many things which require just a volunteer. So you can become a volunteer. And other thing is, if you are get involved with your family. Family is very important. It is the best support you can get. Maybe because of your children's work work pressure, their daily living, their kids problems, they may not be able to support you, but they are not stopping. That doesn't stop you from you supporting them, or you getting involved. So get involved with your family, they will eventually get involved with you. Stay social and purposeful. I've already told you most of these things. So the best way is, keep walking, volunteering, get involved with family, friends, live a life full of connection and meaning. And whatever you do, it eventually will come back to you. So spread love, love will come back to you. Spread affection, it will come back to you. Next thing is, I want to talk few things about neurocardio GI health quickly. So my next thing is about your neuro health. That is the sharpening the Antahkarana, what I call it as Antahkarana. So the first thing is, that is the goal is to make your mentally free and cognitive resilience. That is active involvement in any of these activities, like solving puzzles, playing chess, or learning a new bhajan or shlokas, or learning something new. And that is one of the important ways. Other thing is, when you are walking, this is a very good thing. When you are walking with your friends, you can recite something like mantra, or discussing a book with your friend. That is like dual task. That is, you are walking and you are discussing something. That is a dual task. It will be like, it improves your neuroplasticity. That's what I wanted to tell you. So dual tasking is also very good, because as you age, you tend to do one work at a time. But if you can do walking and you should be in full control. You should see what's happening, and if you are able to discuss, that will improve your neuroplasticity. That is one thing. And this I have already told. Digital challenge: learn one new feature on your smartphone. Every day is fine, that's what I would like you to do, but every week is also fine. Okay, at least to keep your neurons from firing. Okay, and pranayama for brain, that will also help you a lot. It reduces cortisol, protects your memory centers. And other thing is, you can have dry fruits like badam, almonds, walnuts, turmeric. They are all rich to fight the inflammation. You can have those things. And other thing is social connection, either through community groups, laughter clubs. These will help you in sharpening your neurological memory. And regular evening chats at the park or community center, that will also be helpful. It will allow you to prevent social isolation and the risk of dementia and depression. That's what I wanted to tell you. Next thing is GI health. How do you improve your GI health? The thing, how do you improve your GI health? That is by the most important things are: add good food into your diet, as I've already told you. That is something like buttermilk, roasted jeera, and bowl of fresh dahi. That is a probiotic traditionally used, so that is helpful. And fiber rich fiber rich food like ragi, jowar, bajra, that will help you. And one more thing, one more advice I would like to give you is something called as Shatpavali. Shatpavali means it's something which our ancestors used to follow. That is the walking 100 steps after every meal. That will help you in aiding the digestion. So try after every meal, try to walk at least 100 steps. That will help you. Other thing is hydration, as I have already told you, 8 glasses of water. Of course, you can opt for normal room temperature water. Other things are, you can use ajwain, ginger, fennel. All these will prevent bloating and improve nutrient absorption. Other thing is, please sit down or sit at one place and chew slowly and have food properly. That is called mindful eating. And stop when you are 80% full to keep the balance. That is the most important thing. Never eat full. Have 80% and keep a balance, and sit and chew food slowly. The next thing is cardio health. That is for stamina for independent life. What do you do? As I have already told you, 30 minutes of walking in the morning, 30-40 minutes of walking in the evening, or 3 10 into 10 in 10 times 10 minutes, 3 sets. You can do either one set, two set, or three set at your pace. Okay, at your pace. Brisk walking, few people possible, you can do it. Otherwise, at your pace. And low impact options like something like Surya Namaskara or chair yoga, it improves your blood flow. The leg strength, that is, we have what is called a soleus muscle, which is a second heart. Practice sitting and standing from chair without hand support. And another thing is, of course, monitor your blood pressure and sugar regularly. Limit extra salt in pickles and papad. And digital sunset, this is what I would like to advise most of you. Turn off your news screens 1 hour before bed to allow the heart rate to settle for a deep sleep. Try to turn off all digital gadgets. I would say this as digital sunset. And try to avoid salt and sugar. And the other thing is, practice shavasana or yoga nidra for 10 minutes to help you with the heart recover from daily stress. This is one more thing I would like to tell you. And as you have already mentioned, even our sacred texts like Bhagavad Gita, Bible, and Quran, all these things talk about active aging. They say that few things: keep doing your duties, stay engaged, eat, sleep, and work in moderation. That is very important. Keep your mind positive and engaged. Do your work with calmness and balance. So, I would like to tell you that health is not just the absence of disease, it is the presence of vitality. Other thing is, by making these small changes in your brain, gut, heart health, You are not just adding years to your life, you are adding life to your years. So you are, by making this, you are not just adding years to your life, you are adding life to your years. So stay active, stay sharp, and stay independent. Okay? And pain is common, as I have already told you, but dependency is optional. Movement is medicine. Breathe, balance, and brain. Protect all three. Remember this: retirement is from work, not from life. The path is still ahead and is still yours. So you can, whatever I have told today, if it helps you, even for the smallest of the thing, I feel that I have done justice by talking to you about this. I I would like you to take at least few things from here, and that should help you in your daily lives. Thank you. This is a very important, and I like the this topic the most because I am a lung transplant surgeon. Um, Organ donation is the greatest gift of life. Remember this: one organ donor, one me can save up to 7 to 8 lives. Organs which can be donated in our body are, most of you know that eyes can be donated, heart can be donated, lungs can be donated, liver can be donated, kidney, pancreas, intestine, and of course I have already told eyes. So even after life ends, you can give life to many others. Try to spread this message. The greatest gift of life is organ donation, and one organ donor can save up to 7 to 8 lives. Remember this. Kindly spread this message. Thank you.
Thank you, Dr. Sriram. So, for everyone, for a lot of our viewers who are watching, I see a lot of you have stayed till the end. Uh, Request you to please add, if you have any questions for Dr. Sriram, you can add that questions in the comment section below, and we will be able to pick it up. We have two comments. They're not questions, Dr. Sriram, but
Yeah.
Dr.
Yes, sir.
Dinesh Chandra, I think he has joined, and
Okay, sir. Hi, hi, Dr. Dinesh.
Dr. Mariam says, excellent. Thank you so much. So thank you, Dr. Mariam, as well. For anyone else out there, if you have any questions, we will wait for a few minutes. If not, we will end the stream. So, all right. So I don't see any questions coming as such.
Thank
For
you.
everyone out
Thank
there,
you.
yeah. Thank you all. So for everyone out there, please do check out Therapie Multi-Speciality if you require any help or you require any support. Not just for yourself, but say you're an NRI, for your parents who live in Bangalore as well. We are based out of Banshankari. Thank you so much for tuning in. This link will be live even after this session, so you can rewatch it and you can share it as well. So please do share it with your friends and family. See you all in our next webinar. Thank you, Dr. Sriram.
Thank you. Thank you, Nikhil. And thank you to all for attending this webinar. Thank you.
All right.
Good night.